I have to escape our big man for good reasons. At the right time, I'll make a rep for the Ministry of Health to introduce him before he delivers probably the keynote speech. All right, so before I introduce the Vice Chair of the Ghana NCD Alliance to give us the welcome address, so a few weeks ago we met here, some of you not all, to discuss, priorities Ghana is supposed to present at the global convocation at the UN high level meeting. And it was a very wonderful one. There were a lot of ideas and proposals that came on board. And the lead organization, Ministry of Health, actually went for that particular event. There were commitments at that particular event, and that is the reason why we are here, how best we can translate those commitments in our local setting to ensure that we have a robust system working for the good of our people. Basically, that's why we are here. How best we can collectively ensure that those commitments are followed to the logical conclusion. We are able to implement those that we can within the shortest possible time to ensure that we have a very good system that works for all of us. So that is the reason why we are here. And the beautiful aspect of our morning here, basically, is that opportunity to be given to us to ask questions or share. Very important. We'll also get the opportunity to hear from some of our global partners, from the NCD Alliance Global. We'll hear from the Ministry of Health, and some few partners who we have been working for over the years. All right, so that is just my way of round up what we are going to experience this morning. So I would at this moment invite Adam Sebeliza, the Vice Chair of the Ghana NCD Alliance and the CEO of Stroke Association Support Network, to give us the welcome address. Thank you.
Thank you so much, sir. Good morning once again. Let me say that, of course, the chairperson for the Ghana NCD Alliance, Dr. Mrs. Bikishiafiade, of course, extend her sincere apologies to everyone. She's supposed to be here, but unfortunately, I think she is also attending a very important stakeholder event. So I will stand in for her, also in my capacity as the vice chairman for the Ghana NCD Alliance. I'll be brief, yes. So, Honorable Chair, directors from the Ministry of Health, directors from the Ghana Health Service, CEOs from the government agencies, distinguished invited guests, members of the NCD Alliance Ghana, our partners, the media, ladies and gentlemen, good morning to you all. I begin by expressing profound appreciation to the government of Ghana for prioritizing and actively participating in the 4th United Nations high-level meeting on non-communicable diseases and mental health. A special commendation is extended to His Excellency, the President, John Dramani Mahama, for his exemplary leadership during the high-level meeting, particularly his resolute call in action to re-engineer that's resetting health systems worldwide, with a focused emphasis on lower middle-income countries. The NCD Alliance Ghana further commend His Excellency for launching the Accra Reset at the 80th session of the United Nations General Assembly on an initiative anchored in sovereignty, workability, and shared value, emphasizing on the commitments made at the Accra Health Sovereignty Summit in August 2025. This visionary step marks a transition from aid dependency towards health sovereignty, a principle that has garnered endorsement from several heads of states and underscoring the imperative of placing sustainable health financing, especially for whose unwavering dedication and strategy vision are pivotal to advancing a health system that delivers superiority for better patient outcome. This forum serves as an inclusive national platform to one, review Ghana's political commitment and readiness to implement the political declaration on NCD and mental health. Two, identify actionable strategy for integrating NCD and mental health priorities within a broader universal health coverage and health system reform agendas. Three, strengthen collaboration and partnership and delineate a clear roadmap to accelerate progress towards Sustainable Development Goal SDG 3.4, reduce premature mortality from NCDs, and 3.8, achieve UHC, as well as the national health priorities. In conclusion, the urgency of NCD crisis demands decisive, coordinated action. Let's remind ourselves, the looming NCD pandemic demands the same urgency and resources we afford other health crises. It is imperative that we act now with the same intensity and reserve for any other public health emergency, including NCDs. Let us all translate this call, concrete and measurable commitment that embed NCD prevention and care within resilience, sovereignty, and health system. Thank you for your attention.
We can do it better for you. Thank you so much, Adam Sebeleza, for that insightful welcome. There were two things I picked from your presentation. It has been a topical discussion for most, governments, organizations, and agencies. Sustainable finance, that has been a challenge, and then a multi-sectoral approach that you can't do or embark on this journey alone. You would have to involve other organizations or sectors to ensure that we are able to work together effectively. Sustainable financing has always been a challenge. Yeah. For my boss, my boss has always been apt and critical that the companies or the products that are causing us or bringing us to this or that have brought us this very far, they are within our reach. The tobacco, the alcohol, the unhealthy diet, the physical inactivity, and then the air pollution. We have the power to control them. So for us, we believe in taxation. That when these products are taxed, that revenue can be used to support health promotion. Thank you so much, Adams. All right, so the NCD Alliance, who are we? So basically, we belong to an umbrella organization. We take inspiration from the global NCD Alliance. So whatever you see us do, that is where we derive our authority and motivation from. And this morning, we are so much privileged to have Jessica Meji Kwash, a member of the Global NCD Alliance, who is going to present on the overview of the fourth UNI level meeting on NCD and mental health and the political declaration. So they are the bigger picture we always look at. They understand the global issue more. So they are those who direct us to also ensure that we are able to do something within our local sector. And this morning we are privileged to have them to share with us what transpired, basically, the overview and what Ghana needs to look at going forward as a nation. So we are going to hear a presentation from them, who is going to share with us via online. I hope she's online. All right, so Jessica Ameji Kwash, this is your moment. Let's have a presentation, and I hope you are going to hit the nail at the right point for us. Thank you. So Jessica, you can hear me. Kindly introduce yourself and take over.
Yes, I can hear you. Thank you very much, Chair. Me well as well, just checking.
Hello, Jessica.
Yes, can you hear me?
Yeah, we can hear you loud and clear. Thank you.
Okay. Can you see my screen as well, just to check before I start?
Yes, we can.
Okay, perfect. Just give me 1 second. Thank you very much, Chair, for the introduction, and good morning, dear Excellencies, ladies and gentlemen. I'm really happy to be here today, and I would like to thank the Ghana NCD Alliance for co-organizing in collaboration with the Ministry of Health this important stakeholder engagement meeting. Really to, as this has been said, to reflect on what has happened in Europe through the high-level meeting on the NCDs and mental health to see, what are the key learning, what are the commitments, and to, discuss how we can translate that into action, in Ghana, given the current context. So it is a great build-up to the meeting that took place, in September, with some of you really to prepare for that key event. I really hope that it could allow us to identify key concrete ways, pathway, and opportunity to really accelerate implementation on NTDs and mental health. So today I will share, overall reflection from NTD Alliance on this key moment, and highlight some, critical next step that we see, from NTD Alliance global perspective. So, as you know, this fourth high-level meeting on NCDs and mental health was a key major milestone in the global response to NCD. And that's where we saw big governments, reaffirming their commitment through the political declaration, which is the outcome document of this meeting, that included new global interested target on the road to 2030, the key deadline to achieve the SDGs. And this week of the high level meeting was a grand culmination, if we can say, of the whole process that the Global NTD Alliance led, by mobilizing all our members, more than 400 members across the world, have civil society actors engaging at the national, at the regional, and the global level to maximize this moment, which doesn't happen quite often. So it was this week was a key moment for NTD Alliance that led different events and co-hosted many others, in collaboration with the different alliances that we have, but, in collaboration between member states. It was a culmination as well of the 2-year campaign that we led, that you may have seen and heard of through the Ghana NCD Alliance, the Global Week for Action on NCDs, where the theme was "It's time to lead on NCDs." I really would like as well, to commend the work of the Ghana NCD Alliance, throughout the years. On the day, at the high-level meeting itself, we saw strong intervention from different member states that, highlighted their key priorities, and that includes, Ghana, where, we really welcomed, and, we really commended the intervention, from the minister, where it has been highlighted the need to have effective response, relying on integration of NCDs and mental health into primary healthcare. He highlighted the need to have courageous action on the commercial determinants of health and really breaking down the financial barriers to allow the population to have access to high quality care, and that's something that not a lot of member states really highlighted. So that was really, really, really great to see. He mentioned equity as well. So clearly, it marked the NCD Alliance. So in terms of where we are now, the political declaration text is basically the result of a whole process of negotiation between member states, with the co-facilitators that has been assigned by the UN. The process took, months, and it has been a tough environment. If we can say, NCD Alliance has been, following the process quite closely, and we saw that, the current geopolitical context, clearly has influenced the discussion. We've seen, countries coming together, and coordinating in blocks to negotiate the content of the text, which prove, challenging for many countries that are, championing the NCD agenda. And, key countries, for example, like the US, we denounced, the content of the political declaration text. They were also questioning the role of the UN, saying that the process was quite challenging. And we know that the industry was also playing a role. We know that they've been meeting member states in New York and in Capitol. And we know that it has impacted really the some content on the text on the language. It really shows how the NTD agenda is really affected and really linked to the global the global landscape in general. So on the day the high level meeting, the president of the General Assembly, at the end of it, said that basically there is broad support for the text and referred it to the General Assembly of the UN for adoption. And it was a bit surprising for many organizations, many partners, because usually in previous high-level meetings, at the end of it, basically, we say that, the text is approved, that is adopted, and there's, a lot of acclamation around it, which was not the case on this iteration, which is why, some people were a bit confused, basically. Just to say that the text being referred to the UN General Assembly for adoption is, the formal process, but because of the different complaints that we heard coming from several member states, including the US, now we are in a place where we are basically waiting to see what is going to happen in practice, because currently it's a bit uncertain. We know that there will be a working session that should take place in November. We heard, a working session of the UN General Assembly. But the question is, when it is going to happen and who is going to basically table the text, at the General Assembly. It can be through the president of the General Assembly or a member state. And it's a waiting game basically for now. We are confident that it's going to be, adopted. The question is, when, and we keep our ear out. And of course, yeah, we'll share whenever we have more intelligence on that front. But that's where we are now. In terms of the text itself, NTD Alliance really welcomed this new political declaration for its renewed commitment. That really included, some key global and traceable targets. And that's something that is a first, for political declaration on NTD. So it's really important benchmark, basically to translate, to have critical accelerated at the national level, because that's where basically the delivery matters the most. So it includes a global target, for example, that have 150 million fewer people using tobacco products, 150 million more having hypertension under control, and 150 million more people having access to mental health care. There are several other targets that are included, that we really welcome. In terms of air pollution and mental health, it was really great to see them included in the text, aligning really with the 5x5 agenda. And it was something, we really welcome. However, the fact that fossil fuel were not mentioned at all in the text was quite concerning, because we know that first of all, the key driver for for both climate change and pollution. So there still need to do some advocacy push on that front. There was strong language on access to medicine and equity, calling for affordable essential medicine, technology, and financial protection for the population. And the text was also quite inclusive, if we can say. We saw improvement from the previous version of the political diversion text of previous year, where now we see reflected in there oral disease, kidney disease, rare disease. The list is of course not comprehensive, but it's more inclusive. So these are the points, if I can say. Uh, but of course, the other success is really on prevention and financing. From the first draft that was circulated, to the very last one that will be adopted soon, the language has been really watered down when it comes to prevention, especially the commercial determinants of health and the conflict of interest language. Basically, the commercial determinants of health are not mentioned, which is something that we really, really pushed for as civil society. It's not included. They mention the commercial factor, having an impact on health, which is, we would have preferred really to see the terminology, because it really shows that they are determinant of health. This is something we need to address. The same level as the social determinants of health, like we see often. So that's something we're not really happy about, because that the word, the terminology matters a lot in such documents that that are said to be ambitious and to really support member states and to implement their NCD and mental health response. So something to have in mind, and it's basically the result of the industry, of course, playing a role, on that front, and it's the same, with the, for example, the food products, that are high in salt, sugar, and fat. Basically, they're not mentioned now as well in the text, which is, but they were in the first versions. So something to be aware of. Social participation is mentioned, but civil society is recognized only once in the text, which is something to continue to push forward to make sure that civil society and people living with NCDs and communities in general are involved in the design and the implementation of the NCD response. As I said, there's no call for increased financing, and fossil fuels are absent. So if you want to have more details, the NCD full response is available online. The link is on the slide, but of course I will share the slide after. But overall, the high level meeting and the mobilization that we led really bore its fruit, because at the end of it, now as of today, we can say that the civil society movement is much stronger and much more coordinated. Within each countries, with each region, and globally, we have been able to see how the different members of the network have strengthened their relationships with different stakeholders. That includes, the UN mission in New York, the mission in Geneva, and government as well in capital. So Ghana NCD Alliance is a great example, as we've been trying to make sure to make the linkages between what's happening in New York, Geneva, and in capital in this negotiation process that was quite tough and quite rapid on the political declaration text. So now to realization to continue to consolidate our efforts and looking ahead now that the high level meeting took place. Beyond the high level meeting, now the implementation and how to translate commitment really into action. As we highlighted, for NCD Alliance, were the key test of political commitment, really in the delivery at the national level, in integrating NCDs and mental health into the UHC response, ensuring that there is sustained financing, that we protect the population from health harming products and industry, but also to foster an environment that is, really health promoting, that promotes your health and the well-being of all. So this post high meeting moment is key really to, for civil society, first, to celebrate achievements, to reflect on the lesson learned, and really chart the path forward, working hand in hand with the government. So it's, as I said, really the time to turn, the promises into reality at the national and regional level. And during the high-level meeting itself, we saw governments that really demonstrated their individual capacity and their readiness, to tackle the key issues, and that includes the commercial terms of health, conflict of interest mechanisms, to implement as well evidence-based solution that includes, cost-effective preventive measures on NCDs. So NCD Alliance really appreciated and welcomed the leadership that has been shown by some governments, and really that includes Ghana, of course, where we saw the mention, the need to include people living with NCDs and mental health condition to be included in the discussion at the national level that really impact the NCD response, but also the implementation, the integration of NCDs and mental health into primary health care, the need to have sustained financing and courageous action, on commercial diplomacy that we really commend, because we know how tough the negotiation process have taken place, and we see how the language has been watered down, over the weeks in the summer. So really seeing Ghana's leadership, and it's a leadership that we've seen for years now, and we know that it can really have an influence on at the regional level. It can really inspire other countries, to really commit, and to see concrete action at the national level. And we know that right now, with the national health insurance levy that has been uncapped, kind of medical trust fund that is, being structured now, for its implementation. We know that there's need assessment that is ongoing, really to identify all of the gaps and to prioritize them, how to address them to make sure that the population have access to high quality healthcare, across the nation. We know that there are currently, PHC reforms, including, the implementation of the free primary healthcare policy. And that's, these are key moments at the national level that are really important to leverage and to see how how actors from different sectors can really work together, so that this implementation of these different initiatives can really have an impact for the population. But even beyond the national level, we see how Ghana is seen as a leader, at the regional and global level, with the president leading some initiatives, like, we saw the Africa Health Sovereignty Summit that took place not a long time ago, where, I think there's been an announcement that the presidential task force will be taking place on global health governance, and this is a key moment, where we know there are discussion on the global health architecture, the global health governance. So with this Accra Reset as well, that, as a call from the president really to shift the paradigm, towards a more equitable and global cooperation. It's something that we really want to follow and see how this can move ahead, and NCD Alliance is really, happy to contribute wherever it is possible. So yeah, really, really happy to see the leadership of Ghana on that front. And what I can say in terms of the key priorities for NCD Alliance when we think about 2026 and beyond, the key priority for civil society actors, but also, for governments in general, is really to work on, industry interference, to guard the policy making space from industry influence, and to promote transparency. We know that there are current discussion at the WHO level, that there is a strategy that is being drafted on economics of health for all, which really wants to place health at the center, in economic policies. So something that we are following at the global level, but we really encourage all countries as well to see how we can work and with the WHO to be part of this, for, finalizing the strategy, but also, to implement it. Of course, another priority is to champion the meaningful involvement of people living with NCDs and mental health condition. That's one of the core pillar of the work at the NCD Alliance. So something that we really want to see, ramping up, at the national level. Of course, building multi-sectoral partnership, of course, government and with civil society actors. As we know, the health actors alone cannot, address all the issues that are that affect entities. So it's really key to build the mechanism in place to make sure that the civil society and the communities are part of the response, part of the solution, as well. And of course, advanced accountability mechanism. There are existing ones. How to, we need to think about how to strengthen them at all level, at the national, regional, and global level. So that's looking ahead for next year. But of course, we need to have the big picture in mind, the road to 2030. And what I can say in terms of the global milestone that we will follow. For next year, we know that the WHO Global Monitoring Framework will be updated, revised, and/or extended. That's something that we are following closely. So yeah, but if you have some information on how the process will go as well, we will be happy to hear. This is something that we want to see how it is going to be reflecting the commitments and the target that are in the political declaration text. And we really, we encourage basically, the key actors in Ghana, the relevant actors to follow the conversation as well where possible. The third global financing dialogue on NCDs and mental health, we know that it will take place next year as well. It might be in August 2026. The date still needs to be confirmed. But another key moment, of course, to advance, the NCD financing agenda, and probably an opportunity for for Ghana to highlight the work that has been ongoing on that front. High-level meeting on HIV/AIDS will take place as well. We see that as an opportunity to call for more integration, of NCD and HIV services in the health system. In the health system strengthening work at the national level, and of course, with the current financial landscape, with the fundings that is really crunching at all level. Of course, we need to work even harder, to break down silos and not really to basically to close the doors to other actors in the health community, but even beyond. So really trying to see how to maximize the resources and to capitalize on them, the resources that are existing and available now. 2027, there will be, of course, the high-level meeting on UHC. So another key moment where, again, integration of NCDs and mental health into UHC would be key. And, even beyond 2027, we know from 2028, there will be early debate on the post-2030 development agenda. So key moment, there will be opportunities, of course, for Ghana, for every countries really to take part in the discussion and to reimagine, how the landscape will be, and what will need to happen, post 2030. But of course, that's what we see at the global level, and NCD Alliance would really welcome your views on what are the key moments, what are the key milestones at the national and regional level. And I guess, that would be really the fruit, of the discussion today, to see what are the key moments where we want to see progress happening, how can, different actors from different ministries, with civil society, with people living with NCDs can work together, on how to implement commitments at the national level. So yeah, really we would welcome your views on that, and of course that will help as well other countries in Africa and beyond to advance as well their action at the national level. So thank you very much, everyone. That's the end of my presentation, and yeah, I wish you all the best, with the discussion today. Thank you.
Thank you very much, Jessica. We are grateful for that insightful presentation. You shared a lot in terms of the overview of what transpired at the UN High Level meeting. But then I want to make it more practical to go take a role here. See, can you on the lines back? Those of you who read the Bible, there is a story in the Bible called the parable of the sower. So the master called his servant, three of them, gave them some talents. He gave one five, another two, another one. And he charged them to go. The one who had five went to trade and multiply, got extra five. The same happened to the one who had two, but the one who had one went and dug a hole and hid that particular one. And his excuse was that he knows that the master is a very hard man. He sows or he reaps what he has not sown. A lot has happened at the UN High Level meeting. There are commitments, it behoves on every nation on how they want to pursue what has transpired at the local level. I'm happy to see Dr. Vision here. We were in his office a few weeks days ago. And I must admit, the man is very good. The man is very good. When I heard the issue of integration of NCDs into UNC, and then the timeline Jessica shared on us to be 2027, I don't think Dr. Vision is ready for 2027. You want it now? Yeah, I was I was watching your face to see whether the issue is ready for 2027. So Jessica, thank you once again. We are grateful for sharing with us so much. At this moment, I want us, or we are going for help. Oh, okay, so sorry. Let me find out if anybody has any question. Probably there was something Jessica mentioned you want to follow up for clarity. You can lift up your hands while we can see for that clarity. Or question. Any question for Jessica? Oh, okay, Dr. Yish. All right. So Jessica, there's a question for you. Can you pay attention?
You said there's a question for me? Is that it? Sorry, I can't hear you well.
Yes. I think I heard or read like the US denounced, is it? I mean, it just said the US denounced the UN high-level declaration of commitments. And what is the stand of the US and Thomas?
Hello, Jessica.
Yes.
Did you get the question?
No, I didn't. Sorry.
Yeah, so basically, the disposition of the US at the global meeting, they disassociated themselves. What is the outcome of that particular position? Is that the question? Yeah. All right.
So the question is how? What is the position of NCD Alliance on what? Sorry,
No, the
I'm
US,
not.
United States. I mean, the United States of
Oh,
America.
the US.
Yes. Disconnecting themselves
Oh,
from
okay.
their political
So
declaration. They never
okay.
supported it.
So yeah, basically.
So what is the position going forward? How should we, approach or see this in the light of the journey we want to embark on as an NCD alliance? What does this hold for the future? The disconnection or disassociation of the US from the declaration. Hello, are you?
Sorry, because it's cutting. Yes. So I heard that.
All right, so
Sorry,
Labram
go
wants to
ahead.
clarify. This can you hear me?
Yes, I can hear you, Abraham.
Yes, so you did mention the fact that the US, they had issues with their country. So what to know what exactly is the position of the US and why did they decide not to support the declaration?
Sorry, Abraham. So yeah, I think I got the question. So basically, based on the US position on the political declaration text, so how can we see that moving ahead? How can we move ahead based on their uh, objection of the text? Is that the question?
Yes.
Okay. So we know that there have been complaints on even the process of negotiating the text. They were not happy. Basically, consensus was not made according to them. So they were targeting the modalities of developing and approving the text. Um, it's really it's really about the language in the modalities, because for the US consensus, it seems that they think it's about having unanimous support of the text, but consensus is not necessarily the definition is not necessarily so. It would be it's really for the president of the General Assembly to navigate how to close basically the process, because we know they're still making complaints, but there's the very vast majority of the countries showed broad support for the text. So in one country, is the US cannot really derail the whole process. We hope so. We are confident that it's going to be adopted, but of course, the US will, probably continue to make their complaints. They were not really happy about some definition or language on the text that was around gender, or the commercial determinants of health. Some word that were source of controversy for them. And some other countries like Argentina, were having statements in the same line. So we know how the US, is questioning the role of the UN and WHO in general, but that's why we think these moments are really important. How to reimagine the global health governance, how to reimagine, the work, between the main funders that, was, mainly, the US, for some of the key projects taking place in Asia, in Africa as well, and Latin America. So how to move away from the dependence on these key programs that have been shut down, like the USAID. So it's beyond the discussion on NCDs per se, but the different initiatives on the global health governance are key to contribute to. And we've seen that Ghana is actually taking the lead on that front, but for many countries as well to come in and to have their say, because basically the future of the global health landscape is being shaped, is being shaped now. So this is something that NCD Alliance, of course, will contribute where possible, and we will share the key opportunities for governments to and civil society actors, not only governments, to have a say, basically, and because we want to see like a more balance in terms of power, landscape. I mean, not landscape, but governance, on health. So that's why it's good to see how countries can be champion, on how to mobilize, resources at the domestic level, for example, and to move away from this dependence. But it's quite, of course, it is complex, and it's not going to change in a day. But the process, is ramping up.
All right.
So I'm not sure that answered the question.
Jessica, thank you so much for that
Um,
insight.
yeah.
Yeah. Life still goes on, whether you in the US accept or not. We have to live our life, very important. And we need to look within. But one of the things she also made mention that is very insightful for me has to do with the visibility and the strong presence of CSOs as such global meetings. And you can't do without CSOs. We have or we play some key roles. Not all nations accept the nature of our work, but then we are working. And then there has always been a global mention of our medical trust fund. I don't know, it's our time to begin to think through as a nation on how we can protect and preserve or make sure we enhance or improve upon it. Very important. All right, thank you so much. On this note, I would want us to go for our health break for 10 minutes. You can pick, you can sit down, relax, get to know somebody, and make new friends. Thank you.
Thank you.